Hi everyone, my name is Jacqueline Britz. I'm a family doctor, and today we'll be discussing motivational interviewing. Our goals for today are to help increase your confidence with using motivational interviewing with your patients in clinic. We'll talk about tips and effective strategies for using motivational interviewing, and we'll also provide some examples of language to use and language to avoid. So when is it valuable to use motivational interviewing? It can be valuable in a variety of contexts, including if your patient has screened positive for risky or unhealthy alcohol use, if you've tried a brief intervention that wasn't successful, if this is the second or third visit addressing alcohol use, or even if you find yourself with a few extra minutes in person or via telemedicine. So let's go through the 4 processes involved in motivational interviewing. The first process is engaging. This involves developing trust and introducing the topics. This can be done at the first visit or over time as you get to know a patient. One example is that you could say to the patient, "We had you complete a bunch of forms and questionnaires today at the office. Was there anything that stood out to you or anything that you'd like to talk about?" The second process is focusing, so getting permission to start the conversation about alcohol. For example, saying, "I'd like to talk to you about your answers to the alcohol questions. I want you to make decisions that are best for you, but certainly don't want to lecture you or discuss anything that you're not comfortable with. Would you mind if we talked about your drinking today?" The third process is evoking. Explore ambivalence and promote change talk. So for example, saying, "What does drinking do for you? And what concerns, if any, do you have about drinking?" Elicit change talk desire. So for example, saying, "How would you like things to be different from the way they are now?" Explore reasons. If you were to cut back or stop drinking, what reasons might there be for that change? Explore ability. How might you cut back in order to succeed? And explore need. How important is it for you to make this change? The fourth process is planning. Assess the importance and their confidence in making a change, and also discuss making a timeline for checking in. So you could use the importance ruler, saying, on a scale of 1 to 10, how important is it to make a change in your behavior? And explore the answer. What makes it an 8 and not a 2? You can also use the confidence ruler. So on a scale of 1 to 10, how confident do you feel that you can make a change in your behavior? And follow up, what would it take to move it up to an 8? Next, we'll review the 4 core principles for motivational interviewing. The first principle is empathy. So why is empathy so important with motivational interviewing? It communicates acceptance and encourages a collaborative alliance, both of which are critical to promoting change. It leads to an understanding of each person's unique perspective, feelings, and values, which make up the material we need to facilitate change. We can do this through assuming a person's perspectives are understandable, comprehensible, and valid. We can also seek to understand the person's feelings and perspectives without judging. You can use the ORS model, which stands for open-ended questions, affirmations, reflective statements, and summarizing. The second core principle is develop discrepancy. Motivation for change occurs when people perceive a discrepancy between where they are and where they want to be. Values and beliefs are key factors. The person, rather than the practitioner, should make the arguments for change. So for example, you could say, "Sometimes when you drink during the week, you can't get out of bed and get to work. Last month you missed 5 days of work, but you enjoy your job and you enjoy doing well at your job. And we know that your job is very important to you." The third core principle is rolling with resistance. So avoid arguing for change. Avoid directly opposing resistance. New perspectives should be invited and not opposed. The patient is really the primary resource for finding answers and solutions. Resistance is actually a signal to respond differently. Reluctance and ambivalence should be acknowledged and even respected, but not confronted directly. Questions and problems may be turned back to the patient for a solution, and explicit permission is given to disregard what the interviewer is saying. Resistance supplies energy that can be used therapeutically. The fourth core principle for motivational interviewing is support self-efficacy. A person's belief in the possibility for change is an important motivator. The patient, not the practitioner, is responsible for choosing and carrying out a change. The practitioner's own belief in the person's ability to change becomes a self-fulfilling prophecy. There are a variety of tools you can use for self-assessment for motivational interviewing. Feel free to look at our website for this particular tool. Next, we have a few examples of motivational interviewing. We will identify the helpful and the not so helpful techniques for motivational interviewing.
Hey, Mr. Joseph.
Hi, Dr. Wessler.
You're back so soon. What can I do for you?
I had an accident, an auto accident, and I've got some pain in my ribs.
Wow, how did that happen?
I was at the bar with a couple of friends. We'd had a few drinks. It was a really stressful day. I was on my way home and a car ran a light and hit me.
Don't tell me you were driving under the influence again. Was that a very smart choice?
I just had a few drinks. Wasn't a big deal. I needed to relax a little bit because it's been really stressful.
Yeah, but this is the third time we've seen each other for an accident that you said wasn't your fault in the last 3 months. You've really got a problem with alcohol.
I know I've heard that before, but I don't drink that much. I don't think it's a problem. It's just stress.
Well, you're drinking more than 1 to 2 drinks a day, which is more than most people, so you really just have to make a decision to stop.
I know I've heard that before, but if it'll get you to stop talking and some other people, I'll do what you say.
Yes, you've got to do something.
Whatever.
So make a change and then come back and we'll talk about it in a couple of weeks.
Okay, I'll be back.
Good morning, Mr. Joseph. It's good to see you.
Good to see you.
What can I do for you today?
I was in an accident a couple of nights ago. I got some pains and bruising here or something. I'm in some pain.
Oh, no.
I came to see you.
Yeah, tell me about it. What happened?
I was at the bar hanging out with some friends. We'd had a few drinks. I left. A guy ran a red light and hit me. No fault of my own.
Oh my, well, I'm going to examine you a little bit. Tell me if something hurts when I press on it, okay? So when did this happen?
Friday night.
And
A few drinks, hanging out, watching some games on the TV, and I left the bar.
yeah, so you were out with your friends?
Yeah,
Yeah, what were you guys doing?
just hanging out. We've been doing it since high school. It was a pretty great way to relieve stress.
Are things stressful for you at home right now?
Oh, yeah, they are. Stressful at home, stressful at work, stressful at COVID.
Yeah, sure. So how often do you say, would you say you go out to drink with your friends?
Oh, probably my friends and I get together probably 3 nights a week, easily.
And how often do you drink?
3 nights, and then, on Sundays when I'm home, that's my time, just me.
Sounds like having your time and relaxing is important to you.
Did I break something?
Well-
Did I hurt? Because it hurts.
Fortunately, I don't think you broke anything,
good.
and I think the pain will subside over the next few days. But I am concerned about your drinking. I'd like to talk to you more about it, if that's okay.
Yeah, what concerns you?
Well, it sounds to me like, you're saying you're drinking 3 to 5 nights a week, maybe 5 to 7 drinks at a time, and that's really more than about 75% of
Wow.
women your age.
Yeah, I didn't know that.
Sure, and I think it's worth discussing making a change to that so that you're healthier
Okay.
and it doesn't lead to some of these consequences like the accident you're talking
Well,
about.
that wasn't my fault, remember. I got hit.
Sure. Well, what do you think would motivate you to make a change in your drinking habits?
The main thing is probably my kids. Just, making sure that they're 5 and 7 and, they got to grow up. And so they're the apples of my eye. And
Well, that's important. It sounds like your kids are very important to you, and I agree. So what do you think would prevent you from making a change?
Well, how do I manage my stress? I mean, there's so much of it going on. I relax for a few hours. I can't help if I get run into by somebody else, but a few hours of relaxation really helps me.
Do you think you could not stop by the bar on the way home from work?
Well, that's a little hard. We've been doing it a long time, probably since high school.
So what other things do you think you could do?
If it looks like a problem, I could cut back a beer or 2. That's not hard to do. I don't drink that much.
That sounds great. I think that's a great goal to have. Why don't we say you could cut back 1 to 2 drinks each time you're going out with your friends or drinking by yourself at home, and then let's get back together again in a
Okay.
couple of weeks to kind of see your progress.
Easy. I can give that a try. Sure.
Sounds good. Okay.
Well, thanks.
We'll see you in 2 weeks.
Okay, great. Appreciate it.